Everybody. Welcome to this virtual Zoom episode of Two Piece Podcast. I am joined by Amelia. I am Carly. And today we are going to talk about OCD. It's one of those disorders that the term itself just gets thrown around a lot. So we thought we would just take a couple minutes today and kind of go through, in fact, what OCD actually means. So OCD stands for Obsessive Compulsive Disorder, as you probably know. So it is an anxiety disorder. Amelia and I were just talking about that and how a lot of people don't know. Like before this program, we were saying we didn't even know that OCD was an anxiety disorder, but it makes a lot of sense when you actually think about it. So basically it involves like these uncontrollable, like ritualized behaviors that you feel the need to perform. So there is an obsessive thought, followed by anxiety, followed by the compulsive behavior, and then kind of like a temporary relief. And it is temporary. And this is what happens with OCD, and this is why it becomes almost an addiction in a way, because we get that temporary relief. And then it is like anxiety, because with anxiety, we want to relieve that anxiety. We get that temporary relief. We're feeling pretty good about ourselves, but then it kind of ramps up and it comes back into our lives in one way or another. Another thing that I think is important to mention with OCD is it's possible, and I didn't know this before this program either, and Amelia, you'll have to tell me if you knew this too, but you can have only obsessive symptoms, or you can have only compulsive symptoms. You don't have to have both together. Did you know that?
I did not know that.
Yeah, I didn't know that either, but I'm trying to figure out how that would actually work.
Yeah, that seems interesting. I always thought that it was paired. I thought it was always paired with obsessive obsessions and compulsions because I guess if you have obsessions and you don't act on them, I can understand that part of it. But having a compulsion, but not actually having the obsession to push you to that compulsion, that's
right. So there isn't the forethought, but there's just the need to act that out.
Right. I had no idea. I guess it makes sense when you kind of look at it from like a logical perspective. It kind of makes sense. I guess you can have obsessions, but you never do anything about them. And then you can have compulsion, like you said, without forethought. So you just do it, but you haven't really given it much thought. That's interesting. That's more like, it's like compulsive behavior, I suppose.
Totally. Yeah, that's exactly what it is. Interesting, hey?
Yeah, very, very. Thanks for bringing that up.
Amelia and I were talking about how people throw the term OCD around like quite a lot whenever there is this like ritualized behavior. But we kind of wanted to point out too that there is a difference between perfectionism and obsessive compulsive disorder. So OCD thoughts, maybe these aren't, excessive worries about real problems in your life or liking things cleaned a specific way. They will like majorly implicate the quality of your life in like a fundamental way. And that's when we will see somebody who's actually diagnosed with OCD. And we were talking about how when people have mentioned like, oh, like I'm so OCD, or however they want to phrase it, how it can actually be really harmful if there's somebody that's really like, as I said, somebody who's really fundamentally struggling with this disorder.
Mm-hmm. Absolutely. I think that's important to talk about too, because we're so educated in mental health, being in a Master's of Counseling program where we're very aware of sensitivity with diagnoses. And so I think for people who throw that term around, it's not necessarily even a fault on their part, because they don't understand that it's not really okay to do that. So we just want to kind of talk about how maybe you shouldn't be doing that. Not to shame you. If you've done it, it's okay. But just moving forward, it's important to understand that obsessive compulsive disorder is very serious. And for a person who has a diagnosis, they could feel as though it's very offensive if you say to them, I have OCD tendencies, or I'm OCD, in kind of this passive way. It's the same with whatever you struggle with. Like if somebody is dealing with an eating disorder or something. I remember watching an episode, sorry to mention the Kardashians, but I watched an episode of Keeping Up with the Kardashians, and I think one of the sisters was like, "You're so anorexic looking, you look so good." And they got slammed for that comment. They got so slammed. And later, it might have been Kim who said it. But later she said, "I'm so sorry. That was so insensitive of me to say." But she wasn't understanding that, there's somebody who's dealing with anorexia who's watching this show. And if you're validating that that's a good look, they're going to continue with their sickness because they think that that's what beautiful is. So it's just about being sensitive and understanding that when you talk about something in a kind of a passive way, it can be really impactful to somebody who is struggling with it.
Totally. Yeah, for sure. I wanted to talk about kind of like the causes of OCD a little bit, because they're not fully understood, like a lot of things in psychology. Like we've only kind of skimmed the surface of that. So people think that it's something that might be just learned because there is an anxiety, like it is an anxiety disorder, and then we're relieving that. And then it, like I said before, it almost becomes like an addiction. It becomes a habit that we need to fulfill. So some people think it's just like a learned behavior in a way. Some people think that maybe it's like genetically linked. And then some people think it's just something like a biology in our brain, something about like our neurons. And scientists said that there's like a link between OCD and kind of differences in the development of your frontal cortex in general. So like, again, like I mentioned, that part kind of up here. So people with OCD, they have essentially like a hyperactive neural circuit between the prefrontal cortex, which affects like our decision making, and then something called a nucleus accumbens. I'm not sure if I'm saying that right, but I think so. So basically, this is the part of the brain that is kind of like acts as the reward system. Hormones like serotonin and dopamine, so those things that kind of lift us up and make us feel really great, they might also be involved, but it's really unclear. Like it's probably all three of those things that are involved in somebody developing like an OCD disorder.
Interesting. Thank you for bringing that up. Thank you for talking about the brain chemistry side of things. I think it's valuable to understand that always. But yeah, it's interesting. I think it's important to understand that somebody who is diagnosed with any sort of mental illness, I think it's important to understand that sometimes their brain is not working at the same capacity as somebody who doesn't share in that diagnosis, because I feel like it's common in some respects for people to say, well, just stop that behavior. Like it's easy to stop that behavior, but it's not as cut and dry as that, obviously. So I think it's valuable to understand like the brain chemistry side of things, and just kind of give voice to that because it's important to understand.
Totally. Yeah, I feel like that's all I had. I just kind of wanted to shed light on what OCD entails. I don't know if you have anything else.
Yeah, no, thank you for sharing. I have a little bit of info that I can kind of add to. So kind of as Carl said, OCD, Obsessive Compulsive Disorder, it is an anxiety disorder in which people experience repetitive and disturbing thoughts and behaviors. So people who are diagnosed with OCD generally perform a specific ritual in response to their obsessive thoughts. An example may be checking their keys over and over again, which would be the compulsion, due to the fear of losing them, which is the obsession. So I'm going to add a chart here, but I'll just verbally say it. So there's a cycle. So as Carl's mentioned too, obsession, anxiety, compulsion, relief. So to give a bit of an example, so obsession could be constant thoughts about whether or not the oven was turned off, even after checking it once. The anxiety, the obsession causes strong, uncomfortable feelings of anxiety. The person feels compelled to act to remove the discomfort. The compulsion would be repeatedly checking to confirm that the oven is off, possibly going to great lengths like leaving work and coming all the way home to make sure that it's off. And then you experience this relief. And to be very clear, temporary relief. The individual experiences relief from that anxiety. However, the obsession response has been strengthened for the future now. So that temporary relief is actually strengthening the response to do a compulsive act to alleviate the anxiety. So it becomes this vicious cycle. And in the image that I'm going to add here, it's arrows that are constantly cycling. So it's not just like obsession, anxiety, compulsion, relief. And then it's like obsession, anxiety, compulsion, relief, and it doesn't stop. So that relief is causing such a strong response. And it's not something that just satiates the situation long term. It'll be something that satiates it for a very short term. And then the only other thing that I had was I didn't want to go too far into treatment because I'm definitely limited in my knowledge of how to treat an individual with obsessive compulsive disorder. But from the research that I had looked at, cognitive behavioral therapy has seen to be a helpful tool for the treatment of OCD, as CBT aims to restructure and reframe thoughts.
Nice. Another successful treatment option, thank you for bringing this up, has also been exposure therapy. So typically like prolonged exposure. So that will kind of involve a various amount of steps, determined by the therapist. But say if your compulsion is, like Amelia mentioned, checking whether the oven is off, a therapist might put you in a situation where you are not, like, you have to refrain from the compulsion, and that will happen for like a prolonged period of time, and it'll get longer and longer depending on how long your treatment period is.
Right. Yes. Thank you for bringing up exposure therapy. I've seen that modeled before, and it's such an interesting technique because it's going to a place where you absolutely don't want to go, because if you think, well, I need to check on the oven, and a therapist is telling you, well, you can't, we're just going to have to stop. It is strengthening that response of not having to check on it. So it's so powerful, and it's such a great way to treat it. It's not easy, but I think it's one of the most powerful ways to treat obsessive compulsive disorder.
For sure. And another thing that I have seen that's really helpful, of course, with OCD are antidepressants as well. If it's like a very, very severe case of OCD. But
yeah, I was reading that as well with the medication side of things too. Sometimes, sometimes medication paired with exposure therapy or paired with CBT, it can be really valuable, because sometimes you're not able to get to the place where you're going to therapy without a little bit of help. So if you turn to medication for a short time or long term or whatever it is, there's nothing wrong with that side of things either. I know sometimes there's stigmas with talk therapy too, but there's stigmas with medication. And so if you need it and it's going to be helpful in your life, there's absolutely nothing wrong with going towards that side of things too.
Sure.
Mm-hmm.
Awesome. Thanks for the info. I think that we're good to wrap things up, but thank you guys for listening or watching this episode of 2P's podcast on obsessive compulsive disorder. We hope that this added to your knowledge of this disorder. And thank you for listening.
Thank you, everyone. Take care.